Life on the frontier in British Columbia is fantastic, so long as you're healthy. Get injured, or worse yet, suffer from a chronic condition, and up until now, healthcare was usually a sirens-blaring ambulance trip to a hospital more than 100 kilometers away. It was a problem, a big problem for many reasons. Then one day a solution emerged. Members of the Ambulance and Paramedics Union came up with a way of creating sustainable employment for ambulance paramedics in remote communities, and at the same time dramatically improving the well-being of the people they served. The Community Paramedicine program came to life and now provides high-level care for elderly patients in 99 remote and rural communities throughout the province. The benefits include, but are not limited to, aging in place for seniors. Families get to remain united. Health outcomes are improving, and paramedics now are assured a stable job. This is a made-in-BC solution to a BC healthcare challenge, a remarkable success story. We invited Nancy Kotani, the Chief Transformation Officer of BC's Emergency Health Services, to join us for a conversation that matters about the remarkable success story that is improving the lives and health of people in remote and rural communities in BC.
Conversations That Matter is a partner program for the Centre for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the support of the following and viewers like you.
Welcome, Nancy.
Thank you.
Very nice to see you here. And also, as you know, I'm absolutely fascinated with the community paramedicine program. And I think it's something that we need to celebrate here in British Columbia, but most of us don't know what it is. How do we characterize what the community paramedicine program is?
So I guess the best way to describe it is paramedics have a number of important healthcare delivery skills, and they use those skills every day when someone calls 911 on a pre-hospital call. But those skills of assessment, of some diagnostic skills and treatment can also be used in situations to prevent a 911 call. So community paramedicine is taking the skills and the attributes and the talents of paramedics and applying them into settings that are not a 911 call, but a community-based event, and in so doing, try to prevent 911 calls from occurring in the first place.
I think it's important, though, that we point out that this is a program that is designated or delivered in remote and rural communities.
Yeah.
Downtown Vancouver, this is not the program. I mean, you call 911, they're rushing you to the hospital. They're not doing that preventative work. But out in remote and rural communities that have always had kind of a secondary level of care, this is a tremendous, advance in the delivery of healthcare.
Yeah, I think you're absolutely right. I mean, when we look at rural and remote parts of British Columbia, access to care is a great issue. Distance to care is another issue. Populations tend to be older, and they're rooted in their communities for very good reason. Community paramedics, we're fortunate to have about 99 ambulance stations in small town British Columbia, and this is the basis upon which we can build a community paramedic presence to help fill some of the gaps in primary care and community care, but also be there when the time is needed that someone needs an ambulance.
These were 99 stations that were in place. It's not like you had to put them in place, it's that you've repurposed equipment and personnel to be able to deliver a different level of care.
Yeah, that's right, and I think that's what's truly the most elegant part of community paramedicine in British Columbia is exactly that. It's the resource is there, but it's a resource that was based only on responding to a 911 call. Now, in towns where the population is small, and 911 calls don't come that frequently, and so it's very difficult to keep a paramedic in those communities because there isn't the work there.
So does that mean that you could have had a station without somebody attending?
That's right. We could very well have a station where it was very difficult to staff it, and there would be out-of-service times because simply the call volume alone wouldn't keep a paramedic in that community. But with community paramedicine, now we have the ability to not only be available when those 911 calls occur, we also have the ability to introduce that paramedic into the community healthcare system, where they can provide home-based services to older people living in their communities, living and dealing with chronic conditions, and help them stay in that community. One of the things over the 18 months to 2 years that we've been active is we've seen a dramatic decrease in the number of 911 calls by people who are visited by a community paramedic by somewhere in the neighborhood of around 40%. And these are calls that would have been calls that in the healthcare system we refer to as sort of ambulatory sensitive. That means to say they're chronic conditions that if they were properly monitored, people were supported in how to follow their medications and how to manage their diet and do a number of other things, they probably wouldn't exacerbate their condition and have to call 911 or have to go to emergency department. And these are precisely the kinds of calls that we're mitigating with community paramedicine.
So I got to get you to hang on for a second while we take a quick commercial break.
Okay.
We'll be right back.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
How are you now able to get somebody to stay, like to take that position now, whereas not before? Wouldn't you just pay them to be there before? Or is there a different structure around the way that somebody, if they're only responding to emergency calls, is compensated and therefore didn't make it like an attractive career option? Yeah,
and much of what happens historically within rural and remote stations in BC Emergency Health Services, and we're not alone in this, is it's paid by the number of 911 call activations. And so it's a casual kind of standby workforce. And that's a difficult way for somebody to make a living and to be able to use their skills to the best of everybody's advantage.
Well, especially if they're a trained healthcare professional.
That's right.
They had to invest in training for that. If they're sitting around waiting for an emergency and there aren't any, which we hope there aren't, but there's no compensation for that person, well, then they can't live.
That's right. And so with the support of our union, the Ministry of Health, we were able to create regular full-time and part-time jobs in these communities. So for the very first time, there are regular positions in some of these small, very small communities, and that's made a world of difference, both to paramedics and to the people who live in those communities.
Well, one of the things that I note is it's as though they are the only healthcare professionals now in these remote and rural communities, but like the only healthcare professionals in the province who are actually making house calls.
That's right. It's a unique part about building on the skills and the competencies of paramedics, because paramedics provide care wherever you need it. It's not a discipline where you have to make an appointment and come to an office or go to a clinic. And so that ability to be able to adapt and provide care wherever people require it is a hallmark of community paramedicine. People, they have scheduled visits. They see people on a regular basis in their homes. They work through a care plan. They do that in a very deep partnership with the healthcare team that services those communities. It's a great network of care.
It's my understanding also that there is remote monitoring of patients. So because we live in a day and age where, let's say I'm taking my own blood pressure, well, I can upload or, link up that, whatever the reading was at that time, and the community paramedicine gets the report, or paramedic gets the report.
That's right, that's right. We call that home health monitoring.
Yes.
And internet technology becomes more available throughout British Columbia. It's available in smaller and smaller communities. And essentially what it means is that a patient that a community paramedic may be seeing, who they're monitoring for high blood pressure or diabetes, we provide them with the equipment to be able, we teach them how to do some of those daily sort of tests on their own. And that information is transmitted electronically directly to the community paramedic and to their care provider. And following certain parameters that are set by their family doctor, we monitor that situation and can advise both their family physician or their nurse practitioner and importantly the patient, that something seems to be outside of the parameters that we're hoping to be able to follow, and maybe we need to be able to make an intervention. But it also helps patients become better at self-management. And when you're in communities like Barriere, where you might be an hour and a half from your family doctor, this is a great source of comfort and gives people a little bit more confidence that they can continue to live independently in their own communities and know that their conditions are being monitored, and if something should seem that it's a bit off, the community paramedic will make a home visit and interventions can start.
Do you find that when people know that they're being monitored, that they actually pay a little bit more attention to their own well-being? It's as though they go, well, somebody else is watching, and so I better be good about this.
I think for some people that's the case, but I think for lots of people as well, it's when we learn how to live with our chronic conditions and know how to relate what I ate with what's happening to some of my diagnostic results, we're able to do a better job of taking care of ourselves. But for sure, I think the idea that somebody's paying attention makes a difference.
There is the home health monitoring.
Yeah.
And that can trigger an out-of-routine visit if something's a little bit out of sync. How often are patients regularly being visited by the CP in their community?
Well, it depends on the condition of the patient and the agreements that we make with both the patient and their family care team, their primary care team, but it's upwards of maybe twice a week, depending on their condition, or once a week. Sometimes it's only once a month because the patient's relatively stable, and we just need to be able to check in on them from time to time. It all varies according to the needs of the community, the care providers, and the patients, most importantly.
How is somebody identified and becomes eligible to be on this program?
So all of the patients who are part of community paramedicine, and right now I think there's upwards of 1,000 in British Columbia, more than that, are identified by a primary care provider in the community.
You said 1,000 patients in BC?
About that now,
So
yeah.
These are 1,000 people that a year ago or 2 years ago before the program wouldn't have had this kind of access to somebody who's giving them that primary level of care.
That's right. There wouldn't have been somebody coming to their home on a regular basis. There wouldn't have been somebody who sort of knew what was going on with them. There wouldn't be somebody who could be the eyes and ears of a family physician or a nurse in the community who perhaps may only be there once or twice a week, depending on the nature of the services provided in that community. So yeah, it's a big improvement in closing gaps for healthcare in a lot of small towns.
This is our second break. We'll be back in a moment.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
There is a definite benefit to the patient then.
Absolutely.
Are we seeing results that are making a difference in like a drop in the number of emergency room visits from somebody who now is on the CP program who might have gone 5, 6, 7 times in the last couple of years to emergency because they were experiencing some sort of issue that now isn't present because of the program? Have you got that kind of information yet that confirms that?
Yeah, we're gathering that kind of information, and we've been evaluating ever since we started rolling out the program in 2015. But our big, I guess, our indicators are that patients who've been seeing a community paramedic have about a 40% decrease in the number of 911 calls. And that's largely in those areas that we're talking about of managing their chronic conditions. It's all of the things that if we had good primary care, we wouldn't be using the emergency system, and that's what it's proving out to be. So we're really pleased with those results, and we hope they'll continue to grow.
Wow. So traditionally, a paramedic will pick somebody up who has been injured and drop them off at the hospital door, frequently not knowing what the final outcome was. How has the relationship now changed between paramedic and patient, paramedic and the rest of the healthcare team in those communities? Because usually the paramedic was outside of that mix.
That's right. Usually our relationship with the healthcare system, in the past, our relationship with the healthcare system sort of ended at the emergency room door. And community paramedicine is part of breaking down silos within healthcare overall. So the paramedic is now part of the community care team. They attend rounds in that community. They exchange information about patients. They go to see the community nurse and say, I think my patient hasn't been really doing all that well, and these are the results. Maybe we should talk about having a little bit of a huddle about what we could do here. So it's been a great opportunity to build a stronger network of healthcare providers. And I think it's also for those paramedics who've become community paramedics, some paramedics like the excitement of 911 and the lights and sirens part of the business. But others who perhaps some of them who've been around for a while or would like to come back home to their smaller communities or see a different opportunity, being in a situation where they're building relationships with patients, where they get to know them over time, that's the most rewarding part. It's not for everybody, but for those who see this as being an opportunity, it expands the career opportunities for paramedics in British Columbia.
Well, and it allows you to now man those stations that may have been empty. So they're performing a dual role. They're CPs, but they are also still 911 responders.
That's right.
Yeah.
And in many communities, they've been first on scene when there's been a motor vehicle accident or other sorts of things. So yes, that's the dual role, is being able to make sure that we have a sustainable 911 ambulance presence, but also to use those skills and talents of a paramedic in a community setting to prevent 911 calls from happening, especially in areas where healthcare is access to healthcare may be compromised because of geography.
Indigenous communities. Traditionally, there has been a bit of resistance in Indigenous communities to feel as though, maybe resistance isn't the right word, but there's a sense of like, we are not a part of the general health care delivery in British Columbia. Is the community paramedicine program starting to break down some of those barriers because you're now starting to build relationships within First Nations communities? Yeah,
I think very much so, and I think it's been part of the orientation and development of community paramedics and the program to work to create more effective partnerships with First Nations communities, Indigenous communities across British Columbia, and that's beginning to bear fruit. I think it's taking the steps to come to understand the community, to understand the leaders, to understand what some of the apprehensions might be, and to work together with the community to find ways to overcome that. In a number of places, particularly in northern British Columbia, we've made some really great inroads and have some strong partnerships with First Nations communities, and the community paramedics are finding that an incredibly rewarding experience as well.
Third and final break. We'll be right back.
Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program.
It's also my understanding that, okay, we've discussed what the primary purpose of all of this was. We're going to identify people who have chronic conditions. We're going to monitor them. We're going to help them manage their condition and so on. But it's as though the program has already said, well, hang on, if we put on this workshop or if we do that as well, or we help people understand how to put baby seats into their car and whatnot, there can be a greater benefit. Where's this program going to grow to, and how is it going to continue to benefit remote and rural communities?
Well, I think it has we're just in our very early stages. It's only been a few years that we've done this, and late last year, we had our first community paramedic forum. So we brought together all the community paramedics in British Columbia for a bit of a a learning opportunity. And it was so exciting to have them all in one room, but all of them, to a person, started to identify other things that they could be doing in their communities. So it's led us to start to look at what are the things we could do to increase scope. Simple things like being able to introduce flu immunization in smaller communities. There are a number of other things that we think, so there are services that we want to be able to add over time. And we're looking to, as we are right now, introduce paramedics with advanced skill level into communities as well. And we only see this as being just the tip of an iceberg, if you will. Like there's a lot more things that can happen in rural and remote communities with community paramedics, and we're excited about the future of the program.
You've rolled out into 99 communities so far.
That's right.
Do you see it expanding, or have you kind of met the needs of most remote and rural communities with 99 stations, or do you need a few more? Oh,
I think we probably will look to continue to try to roll out more. That was our initial target as the equivalent of 80 FTEs, and and of course, every community that has a community paramedic would like more community paramedic services. And those that haven't had a community paramedic are saying, what about us? We'd love one too. And so we're looking at ways of being able to continue to introduce the program in other parts of BC as well.
And has it been successful in your retention goals?
Yeah, very much.
To keep people in community as far as their profession is concerned.
Very much so. I mean, you'll see that people who were able to be hired into communities where which is home for them, which is they're local to that community. They tend to want to stay in those communities because this is where they live, this is where they want to be, and these are people that they know. And who wouldn't want to be able to provide care to somebody rather than only see them at a time when they need an ambulance, and that's what's keeping people in these communities.
It's pretty innovative thinking. We're going to repurpose some assets that we have. Maybe we'll increase our costs a little bit here, but the overall benefit on so many different levels is extraordinary. You mentioned the union. Where was the brain, trust, or the brain's trust that created the community paramedicine program? Well,
it was very much a joint initiative of BC Emergency Health Services and the Ambulance Paramedics of British Columbia, and they've been first and foremost champions of looking at introducing community paramedicine, and we were able together to introduce it with the support of the Ministry of Health.
I understand there are versions of this in other jurisdictions in a few places in Canada and Australia, but there's nowhere that has this network of 99 stations and this growing, delivery of healthcare in the way that we are here. This is something that we should really be celebrating, isn't it?
I think so. I mean, it partly grows from the basis that we have a provincial emergency health services system. In many jurisdictions, it's still regionally based, just as fire services are regionally based. And so our ability to be able to introduce something province-wide with standards, with recruitment, with retention ability, with connections to the other health providers is unique, and it absolutely is something we should celebrate.
Well, it's truly fascinating. Thank you for coming in and sharing this.
Thank you very much.
And continued success.
Thanks a lot.
Yeah.